brain, cause strokes, it can affect the eyes, cause problems like glaucoma, cataracts, that's what we call diabetic neuropathy, cause you to actually lose your sight. It can affect the heart, make you at increased risk for heart attacks. It can actually affect kidneys, damage the kidneys till they don't work anymore, and you have to go on dialysis. It can mess up the blood vessels in the legs, which we call poor circulation. It can mess up with the nerves, which we call neuropathy, causing numbness, tingling, especially at the tips of the hand and the tips of the feet. It can actually lead to you stepping on something and not feeling it, and then the foot getting infected, and then lead to an amputation on the leg being cut off. So, from top to bottom, head to toe, diabetes can actually affect. Because of that, that's one of the main reasons why we actually need everyone's blood sugar to be controlled. Because once your blood sugar is controlled and as close to normal as possible, then your risk of having any of these complications is the same as anyone else. This is what we want. So, in terms of the complications, today we're actually only dealing with the acute complications of diabetes. Acute means things that actually happen very quickly. So there are only 3 acute complications of diabetes that we'll be discussing. The first 2 are when the sugar is too high. One what we call ketoacidosis, and one what we call hypoglycemic hyposmolar non-ketonic syndrome. And the next one is when the sugar is too low. Okay? So 2 things, either the sugar is too high or too low. And those are the acute complications which we are going to discuss. So, like I said, the sugar is too high, we call that the DKA or the diabetic ketoacidosis. That one is more common in persons with actually type 1 diabetes. And then you have the hyposmolar non-ketonic acidosis, which happens in persons with type 2 diabetes. Both of these is when the sugar is too high, but just one in type 1 and one in type 2. And the last one, the hypoglycemia, when the sugar is too low. So low. So hypoglycemia is when the sugar is too low, and that happens in anyone, whether you have type 1 or type 2 diabetes. So the first one we're going to talk about is diabetic ketoacidosis. And like the word says, it's diabetic, so high sugars. Keto means that the body is spilling something what we call ketones, and acidosis means there's acid that actually builds up in the body that actually happens. So the 3 major problems, like I said, is hypoglycemia. So we're worried about this when we see a sugar level start to be higher than 250. And like I said, this is big for persons with type 1 diabetes. So when their sugar is above 250, we get concerned because this complication can happen. The reason being is when the sugar starts to be high, that means the sugar is high in the blood. If the sugar is high in the blood, that means the sugar is not going to the cells, and the cells need the sugar for energy. So because the cells aren't getting the sugar, and they need energy to do what they have to do, they have to find another way to produce energy. So the other way, anaerobic process that they use to actually produce this energy has a byproduct which is ketones. And ketones in large supply is actually harmful to the body. So the problem is when the ketones build up, it can cause harm to the body, and the body has to try to get rid of it. And the last one is because of the ketones, it actually turns the blood pH more acidic rather than neutral. And the problem is that the blood or everything in the body is used to operating in a normal pH. And if you disrupt that pH, then a lot of the things in the body, a lot of the organs can actually operate as effectively as they can, and can cause damage to the organ, especially if the acidosis is allowed to be there for a long period of time. So, like I said, the ketones are produced by the liver, and it exceeds the use of it, and plus the kidneys can actually get rid of it as quickly as it's supposed to, so the levels start to go up. So a lot of the things that can actually bring it on can be physical or emotional stress. So when persons are stressed, either physically or emotionally, those things can actually cause anxiety, raise your cortisol level, and that can actually cause your sugar level to actually be more elevated and can give rise to this problem. Also things such as infection, if you have any infection that wouldn't heal, The female's pregnancy can also give rise to the DKA, and also extreme anxiety, like I said, because of the stress. So, in clinical practice, ketoacidosis can also occur if persons not taking their insulin or not taking enough insulin. Like I said, this is for type 1. So you use the insulin to move the sugar out of the bloodstream into the cells. So if you're not taking the insulin, then the sugar will stay into the bloodstream. The cells will stop and they have to find another source of energy, and all of that can cause the sugar level to rise. So some of the things that people have with this are, they can have 1 to 2 days of continuing to urinate. So every couple of minutes they go into the bathroom more frequently. 5, 6 times out of the night they're waking up to use the restroom. Also along with this urinating more frequently, they're constantly thirsty, so they keep on drinking. Because the ketones actually leave a fruity flavor in the mouth or on the breath. So sometimes when these persons who are in DKA speak to you, you can actually smell a fruity flavor actually on the breath. Because of it, it can also cause abdominal pain, abdominal cramping, which we can notice. And it can also cause you to actually feel flush, a dry mouth, and all of that. So all of these signs we actually look for persons with type 1 diabetes that can give us an idea of if we think they are going into DKA. Now in terms of this, all of these acute complications are what we call medical emergencies, meaning that they need to be handled right away, as quickly as possible, to actually prevent death or going into a coma. So if somebody is in DKA, they have to go to a hospital. They have to be managed in the emergency room. Usually these patients are actually admitted into ICU, intensive care, to actually have close monitoring and make sure we actually bring down their sugar levels, make sure we get rid of the ketones, and also make sure we actually restore their blood pH to normal pH so the organs can actually operate more effectively. So one of the main things we actually have to do with this in DKA is hydration. Like I said, a lot of the time, because persons are urinating more frequently, the body is very dehydrated, and plus the body needs the fluid to actually help and get rid of the ketones. So one, we actually have to make sure that the person is hydrated. Along with hydrating them, we actually have to try and bring down the sugar. So along with bringing down the sugar, we actually have to start giving them insulin to allow the sugar levels to come down. Whilst all of this is going on, it causes some imbalance in the body because we have to, one, correct the acid. Also by us trying to correct the sugar, sometimes the potassium level starts to drop, so we have to watch that. And potassium is important because the heart uses it to help in terms of moving and contracting. So we actually have to make sure that the potassium level, we get that to stay normal to prevent anything going on with the heart whilst we're trying to manage it. So these are, like I said, accomplished through the administration of insulin and fluids, and we correct any electrolyte imbalance that there may be. So the first thing we have to do is identify that there is this going on, and once we identify it, we have to treat it properly. Any questions about DKA? So this brings us into hypoglycemic hyposmolar non-ketotic syndrome. This one actually happens in persons with type 2 diabetes when the sugar level gets high. The main difference between this and the DKA, which happens in type 1 diabetes, is that persons with type 2 diabetes, how their body operates, the body is still able to utilize the sugar, still able to produce some insulin. So because of it, you don't actually get the ketone production. So you don't have the ketone production. Because you don't have the ketone production, you also don't have the acid actually building up in the blood. So these persons actually have high sugars but no acidosis going on. And a lot of times, like I said, this happens in persons with type 2 diabetes. The main factors which actually cause it is because the pancreas is not working properly and producing enough insulin. And two, sometimes we just eat too much carbohydrates. And the more carbs that we eat, the more sugar that's being entered into the body. And it may be too much for the body to deal with, especially if it's not producing enough insulin, which causes the sugar level to be high. And again, like I said, all of these are emergency situations when the person actually has to be admitted in the hospital, given fluids to help and bring, allow the body to level off, allow you to resolve the dehydration, and also to try and replace any lost electrolytes and to bring down the sugar. Okay? So, we finished talking about the two acute complications when the sugar is too high. One is the DKA, which happens in persons with type 1 diabetes, and the second one is the hyperosmolar non-ketonic acidosis, which happens in the persons with type 2 diabetes. Now we're going on to talk about hypoglycemia. So hypoglycemia occurs when the blood sugar drops too low. In terms of too low, we usually say when you check your blood sugars, we usually want your blood sugars to be 70 and above. So for all purposes, we usually use either 70 or 80 when you check to say that your blood sugar is too low, and you should eat something to actually keep it up. Most of the problems with hypoglycemia, like how you feel and all the symptoms, you actually don't feel until the level gets usually 50 or less. So the reason is we want you to mark it a number before you even get the symptoms, so you can correct it before you actually start to feel bad with the sugar dropping too low. So it's most commonly seen in persons who actually have to give themselves insulin, because a lot of times they either one can give themselves too much insulin or be on too much insulin, or may not eat adequate for the amount of insulin that they are given. So all of that can actually cause the blood sugar to drop too low. Also, some persons who take oral medications or tablets can actually have the problems with their blood sugar dropping low. As you know, when we discuss medication, we knew that certain medications actually stimulate the pancreas to produce more insulin. So those medications may cause the blood sugar level to drop low and cause you to get hypoglycemia. So like I say, many other factors come into play with your blood sugar being low. One is error in your insulin dose. So if you're giving too much insulin dose, or you're using the pen and the pen not working accurately or properly, too much insulin can cause your blood sugar to drop low. Also failing to eat. So you're taking your medication, but you get caught up, you get busy with something, you forgot to eat, just because of normal stress and different things with life. You started, you got a call, you cut off, gone someplace, but you already took your medication. All of that can actually cause problems with your blood sugar dropping low. Also with increased exercise. So when you exercise, it actually allows the body to utilize the blood sugar more, moves the blood sugar out of the bloodstream into the cells, so the cells can use it for the energy while you exercise. So if you exercise a lot or excessively, that can also cause your blood sugar to drop low. That's why when we talk about exercise, we always say you check your blood sugar before you exercise to see what the level of your blood sugar is, to make sure it's adequate for exercise. And if not, then you have to have something to eat prior to exercise, so it doesn't cause your blood sugar level to drop too low. Also, decreased insulin is needed after the removal of a stressful situation. So, like I said, sometimes when you have infection or other stresses, sometimes, especially persons with type 1 diabetes, they may need more medication or higher insulin dose just because of that time and that stress, because the sugar levels are more higher than normal. Sometimes for females during the time of the cycle, the sugar levels are more higher than usual because of the stress and the difference in hormone balance. So sometimes when we increase your medication during those stress, if we don't decrease it after the stress is over, that can also sometimes cause the blood sugar level to drop too low. And also, medication changes and a change in the insulin cycle. So sometimes we actually have to adjust your medication, change your dose or increase your dose, what have you. And sometimes a change in the medication may be at times too much and cause your blood sugar level to be too low. That's why it's important to always measure your blood sugar. First thing in the morning before you eat, after you eat, you can actually make sure that your blood sugar levels are staying within the normal range. Now there's something about alcohol. Alcohol actually decreases liver gluconeogenesis, and people with diabetes need to be cautioned about the potential for causing hypoglycemia. So what that says is that the liver is responsible for producing sugar when the blood sugar level drops low. So when your blood sugar level drops low, the body has a way to make the liver produce sugar, so your sugar level always stays within the range, so it doesn't drop too low, it doesn't go too high. The liver is also responsible for breaking down alcohol. So if you drink one standard drink would be one standard beer, one glass of beer, or one shot would be one standard drink. One standard drink actually, it takes the liver 1 hour to actually break that down. Okay? So, let's say we are drinking, and we have 3 beers. And we have 3 beers within an hour.
A glass of wine, red wine.
That's one standard drink, so that still takes the liver an hour to break down. If we have 3 beers within an hour, that's actually 3 hours that the liver will be preoccupied breaking down that alcohol to get rid of the body. It takes half an hour.
Okay.
But it still has to be broken down once you drink the alcohol. But the problem with it is that with persons with diabetes, and if you don't eat before you drink, some persons just go drinking, don't eat. And when you start drinking, you just don't eat. So with that, drinking the alcohol, the liver is now breaking down the alcohol, so that's its only concern, because it believes alcohol is a toxin to the body, so we gotta get it out of the body, so it tries to break it down. So whilst it's doing that, if you're not eating or took your medication and the blood sugar level starts to drop low now, the liver is supposed to actually start producing sugar, like I said, to actually keep it level. But the liver is now too busy breaking down the alcohol. So because of it, persons with diabetes need to be careful, because with medications and everything and drinking excessively, it can cause your blood sugar level to drop low, because the liver will be concentrating on something else and can't produce the sugar when the levels starts to drop. So that's something to be mindful of. So some of the symptoms that you feel when your blood sugar drops low are, you can actually have headaches, you can have difficulty concentrating or solving problems. So if somebody says 2 + 2, you be like, man, I don't have time for that, because you can't answer the question. Sometimes with persons, when their sugar starts to drop low, they actually have disturbed or altered behavior. Some persons become more aggressive. Some persons, you ask, what's your name? They're going down Palmdale, so they answer you where and not the way that they're supposed to, depending on the question. Sometimes it can actually cause you to go into a coma, or you to have seizures. Now, one organ in the brain, I already give the answer. One organ in the body only uses sugar or glucose for energy. That is the brain. So because the brain only uses sugar for energy, the brain is the first, or one of the first that's affected, organs that's basically affected because of the low blood sugar level, and that's what can cause you to actually go into a coma and start to have seizures. So all of these things that you can actually have sweaty, shaky, dizzy, grumpy, confused. And sometimes a lot of these symptoms are similar to when your sugar is too high. So the only way, or the best way to know, to be sure, is to actually test and check your sugar. Because we don't want you feeling this way and you say, you know what, my sugar is too high, so let me go drink some water. And it's actually that your sugar is low, and by you drinking more water, it causes your sugar to even go lower. Similar, if you think your sugar is low and it's actually high, and you say, man, I feel this way because my sugar is low. And you start to eat more food, drink a juice, drink a soda, and then it go even higher than what it is. So it's always best to actually test your sugar before and then properly treat afterwards, so you know where you are and you know where we go afterwards. So, in terms of treating when your sugar is actually too low, we actually have a rule of 15 that we actually say we use. One is that you give yourself 15 grams of carbohydrate, we'll discuss that. And then you wait 15 minutes and then check your blood sugar again to see if it has actually increased and starting to go up. If it has not, then you take yourself another 15 grams of carbohydrate and then check your sugar again 15 minutes later. If it's still not going up and it's still low, then you take another 15 grams of carbohydrate and you head to the hospital or you call A&E or the 911 number. So now when we say you take a 15 gram of carbohydrate, we actually mean something which is what we call a simple sugar. Simple sugars are sugars that are actually taken into the bloodstream right away because your sugar is low. So we need something to go into the bloodstream right away. So to get a good idea, simple sugars means anything that is sweet. So if your blood sugar is too low, rice, bread won't actually help you because the body actually has to break that down first into sugar before it can actually go into the bloodstream. So sugars would be juice, soda, candy, honey, all of those things are what we actually call simple carbohydrates or simple sugars. We also have glucose tablets that they have, some person, that they can actually get a glucose tablet and chew a glucose tablet, which actually causes their blood sugar to rise. So if there's anything like orange juice, then we say 4 ounces of orange juice is enough for when your sugar is low. Or if we're talking about soda, then we say 6 ounces of soda, and that's a non-diet soda. Because you know the diet sodas don't have the sugar. They have sugar substitutes and alternatives. So if your sugar is low, you need to drink a Coke, not a Diet Coke. If you choose to have a soda, it'll have to be a Coke and not a Diet Coke, just so you get it.
No
You have
sweet
to-
soda. Sweet soda.
Yeah, if you want to have a,
So the Diet Coke.
no, I say not a Diet Coke.
Not a diet.
Right, just have some, so you can get orange,
Just get orange juice and coffee.
Yeah, I'll suck it.
orange soda, red cream. You want to ask the question?
Oh, so diet sodas do not elevate your blood sugar level?
No, no, they have a different type of sweetener. Some that usually have fructose or other things.
The dark
that have red sticks
chocolate,
in
that's
it.
good for you. The darkest chocolate, dark chocolate.
Yeah, dark chocolate is good. Dark chocolate is high in iron and everything else.
So you can take it, you can eat that anytime.
What is that?
No, only when your sugar is low.
Just because
That.
everything that you eat or consume has to be done in moderation, no matter what it is. Whether it's good for you or not good for you, everything has to be done in moderation. So just because water is good for you, don't mean all you drink is water every day, all day. Because if you, no, use a different case. Because if persons have just constantly drinking water, they can end up with water intoxication. But that's from long periods of water. But that's just to say that anything, no matter what it is, in large amounts is not good. So everything you have has to be in moderation. You can't say, okay, this is good. So this is the only thing I can do a whole heap of it. No. Everything actually has to be in moderation. And like they say, variety is the spice of life. So you have to have other things with it. Now, alternative methods for increasing your blood glucose may be required if the person is having a reaction or unconscious or unable to swallow. So if you meet someone and they're unable to swallow, they're unable to drink, they're passed out, and they need this high amount of sugar, and there's nothing that you can do because they're not eating or taking anything in by mouth, they actually have an injection, what we call a glucagon injection, that they have, that most persons or a lot of persons with type 1 diabetes who may have the problem with their blood sugar dropping low carry with them, which is a vial that you mix and you actually just stick them, and it gives the body sugar rush to allow them to actually regain consciousness and be able to do stuff.
And you say stick, you mean adhesive?
No, needle.
Needle.
When I say
That's
stick,
the
I mean needle.
diabetic one.
Mainly for persons with type 1 who would have it. Because you have more persons with type 1 who run the risk of their sugar dropping low more than persons with type 2. And the main reason for that is, one, all persons with type 1 diabetes on the insulin. So because of the insulin can cause the blood sugar to drop low, especially if you're not eating appropriately. So that is one of the main reasons. But persons with type 2 diabetes are also on insulin, and some of their medications also lowering their blood glucose, so we have to watch. But we can actually tell if somebody is at higher risk for their blood sugar dropping low just by looking at their values and what is going on. So like I said, this is somebody whose blood sugar is dropping low. You get a glass of orange juice, 6 ounce, let them drink it, and then 15 minutes later, check their blood sugar to make sure that it's actually going up. No, sugar. Everything with sugar is done. You can also drink an 8-ounce glass of whole milk. The 8-ounce glass of milk would also help in actually increasing your blood sugar. And this one is the actual glucagon. What it is, you have a needle that has some solution already in it, and then in the pocket is a little vial with some powder in it. So you pop the vial and you pour the solution in the vial, you shake it up, put it back into the syringe, and then you stick the person in it. And then that helps in actually raising their blood sugar level to help them get back some type of confidence. But you can use the whole milk. But you have the whole milk, you have the 2%, you have the 1%. The whole milk would be better. Like the 1%, 2%, as opposed to the almond milk. So, in conclusion, this is just an outline of a lot of the acute complications of diabetes. Like we said, when your sugar is too high or when your sugar is too low. This was not meant to be that comprehensive, but just to give you an idea, get your palates wet, let you know what possibilities there are to watch out for it, look out for it, and make sure that it doesn't happen. Like we said, all complications are preventable with good glycemic control. So once you keep your blood sugars controlled, once you regularly check your blood sugars, then you know which range you are in, and you can actually prevent these problems from happening. And if you feel that you just don't feel like yourself, then it'll be a good time to check your blood sugar to make sure. Or anytime when you're sick or ill, at those times the blood sugar levels may be higher than usual, but those are good times to definitely make sure that you check your blood sugar level. Because when you're sick, a lot of times when persons are sick, they don't eat. Because they don't eat, they don't take no medication and all of that. So a lot of the times when persons are sick, their blood sugar levels actually rise and are higher than usual. So the progression of most of the complications of diabetes can actually be stopped once they're detected early and treated appropriately and on time.